My dear student, Assalamu alaikum and good morning. Welcome to you all today's lecture. This is Dr. Jannatul Mawa, Assistant Professor, Department of Physiology, Bashundhara Ad-din Medical College. Today, I will discuss about the topic entitled with movements of gastrointestinal tract of small intestine or small gut. Before knowing about the movements of gastrointestinal tract, we need to know some anatomy and histology of the small gut. This figure shows alimentary tract. We know that alimentary tract runs from mouth to anus and gastrointestinal tract runs from stomach to anus. This figure shows anatomy of small gut. A small gut has divided into duodenum, jejunum and ileum. This figure shows histology of the gastrointestinal tract. Gastrointestinal tract has 4 layers. First one is from inwards to outwards. First one is mucosal layer, which consists of epithelium, basement membrane, lamina propria and muscularis mucosa. And the second layer is submucosal layer. Meissner's plexus lies within the submucosa that innervates the glandular epithelium, endocrine cell and submucosa of the blood vessel, and which controls local intestinal absorption, secretion and blood flow. The third layer is muscularis propria, inner circular layer and outer longitudinal layer. Mesenteric plexus, a chain of interconnecting neuron present in between inner circular and outer longitudinal layer that innervates the smooth muscle of the gastrointestinal tract and control the activity of the smooth muscle of GIT, like intensity, velocity, rate and rhythm of contraction. And the fourth layer is serosa, which consists of areolar connective tissue and epithelium. These are the different movements in the different parts of gastrointestinal tract. Today I will discuss only the movement of small intestine. The basic functional movement of small intestine is mixing movement and propulsive movement. Now, what is mixing movement? Thorough mixing of gastrointestinal content with the secretion is called mixing movement. Mixing movement of small intestine is segmentation. Propulsive movement. Food to move forward along with the gut at an appropriate rate to accommodate digestion and absorption is called propulsive movement. Propulsive movement of small intestine is peristalsis. Now segmentation. When the small portion of the gut distended with the content of the lumen, it elicits localized concentric contraction at a spaced interval and lasting for a fraction of minute. It causes segmentation of small intestine. They divided a small intestine at a spaced segment, which appears as a chain of sauces. When a set of segmentation contraction relaxes, a new set of segmentation contraction begins at this time at the new point between previous contraction, and the frequency of segmentation depends on the electrical slow wave of the gut wall. For duodenum and jejunum it is 12 per minute, and for terminal ileum it is 8 to 9 per minute. Now the propulsive movement of the small gut, that is peristalsis. It occurs any part of the small intestine. Chyme propels along with the gut at a velocity 0.5 to 2 cm per second. Total traveling time required 3 to 5 hours to propel the chyme from pylorus to ileocecal bulb. Now, what is peristalsis? It is a reflex response initiated by the stretching of the gut wall by the content of the lumen, and initiating constrictive ring behind the stimulus and the area of relaxation in front of it. It occurs any part of the GIT, especially from esophagus to rectum. This figure shows local control of peristalsis. When stretching of the gut wall by the content of the lumen or any mechanical irritation or physical irritation or parasympathetic irritation, it causes release of serotonin from the enterochromaffin cell. Enterochromaffin cell lies all over the gastrointestinal tract. This serotonin causes activation of the sensory neuron, and this sensory neuron further activate the myenteric plexus. In the myenteric plexus, some neurons are passing retrograde direction that excites the neuron that releases acetylcholine and substance P that are responsible for contraction of the smooth muscle behind the bullous. At the same time, some neurons of the myenteric plexus are passing anterograde direction that activates the neuron to release vasoactive intestinal polypeptide, nitric oxide and ATP, which causes relaxation of the smooth muscle ahead the bolus. So peristalsis can occur in both directions, usually from oral to anal direction due to polarization of the myenteric plexus. Due to polarization of the myenteric plexus, a contractile ring causing peristalsis in the oral side of the distended segment and moves towards the distended segment and pushing the chyme towards the anus 5 to 10 cm before dying out. At the same time, some portion of the gut relaxes few centimeter downstream to anus, allowing food to be propelled easily. It is called receptive relaxation, and this complex pattern is called peristaltic reflex. Peristaltic reflex with anal direction of peristalsis is called law of gut. This is the mechanism of peristalsis which I have discussed already in the previous slide. There are some nervous and hormonal control of peristalsis. Nervous control of peristalsis are gastrointestinal reflex, partly stretching of the duodenal wall, and gastroileal reflex. There are some hormones that are responsible for increasing or decreasing the gastrointestinal motility. Gastrin, cholecystokinin, insulin, motilin and serotonin are responsible for increasing gastrointestinal motility, and secretin and glucagon are responsible for decreasing gastrointestinal motility. It's all about my today's lecture. Hope you will enjoy it. Thank you.